Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. May is National Stroke Awareness Month, and we're going to talk diagnosis and treatment. Also, it's summertime, and if you're getting ready for vacation, we're going to talk travel medicine. That Baptist Health has a new oncology center, and we're going to learn all about that. All that, and Seed Leaf is here. My first guest is Dr. Ashley Rollins, a med-peds physician with Family Practice Associates. Welcome.
Thank you.
Now, you're going to tell us all about vacation, and a lot of us start because a lot of us go to the beach, and there's sun down there, so what do we do with the sun?
Well, the first thing we want to think about is obviously sun protection. There are a lot of different ways to do that, but sunscreen is an integral part. So you want to make sure that you've got a good SPF sunscreen, usually 15 to 30 or higher. Wear long sleeves, hats when you can, and try to take frequent breaks from the sun.
Well, you notice that graphic telling a little bit about sunscreen. A personal privilege here, that's my little grandson sitting on the beach with his can of sunscreen. Kids, okay to use sunscreen on kids?
Absolutely, yes, recommended. Typically a mineral-based sunscreen is going to be your best option, but any sunscreen is okay. Want to avoid the eyes, make sure that you're not getting it too close to their mouth, particularly if they're under 2 years of age.
All right. Now, are there, other than sunscreen, when you go on vacation, are there other medicines you might want to take with you just to have?
Yeah, so certainly you want to take your regular medication that you take. Make sure that you have an adequate supply and it goes in your carry-on luggage, not your packed luggage, just in case there are slip-ups, with things getting lost. And then typically over-the-counter medications that you would normally use, so Motrin, Tylenol, Benadryl, things that you use frequently at home that are over-the-counter, such as allergy medication or nasal sprays.
Okay, that's over-the-counter medicine. Are there other prescription medicines like traveler's diarrhea, sleep medicines that you want to consider?
Some of that depends on where you're traveling, but certainly if you're going to be in an area that has limited access to health care, it's a good idea to take some of those with you. And that's a great thing to talk with your physician about. Particularly if you have difficulty with sleeping when you travel, anxiety with flights, or if you have a history of difficulty tolerating certain types of foods.
Well, now, especially if you're going out of the country, there's some things that you may want to worry about or pay special attention to.
Yes, so the CDC has a wonderful travel website that you can actually enter the country that you're going to be traveling to, the location within that country, and it brings up wonderful recommendations for preventative measures, either with medications such as malaria prevention, or to make sure that you have the correct vaccines for that location as well.
And there's a lot of just routine vaccines that you ought to have anyway, correct?
Absolutely. So anytime that you travel, it's good to make sure that you're up to date on our routine flu vaccine, COVID vaccine, you've had an up-to-date tetanus shot, and then, depending on your age, pneumonia and shingles as well.
So if you're uncertain in terms of vaccination or medicines, it's a good idea to schedule a time with your doctor a few weeks before you go anyway.
Absolutely. I would say at least 2 weeks before you travel. That way, if there are any particularly unusual vaccinations that you need, that allows you time to kind of receive those and for immunity to build.
Like malaria, you want to maybe start the medicine a little early even.
Yes, absolutely. That's something you always want to start before you leave.
Now let's talk about some different things. Should you wear a mask on the airplane now?
So if you look at the CDC recommendations with travel, they particularly recommend masking anytime that you're in close quarters with a significant amount of people. And so certainly airports would qualify, under that consideration, as well as flights.
Now you talk about also wearing a mask. How about support hose for blood clots on an airplane, especially if it's a long flight? Yeah,
and that's a really important thing to remember. So definitely compression socks can help, and then trying to get up and walk around at least about every hour or so while you're on your flight.
Okay, now, if you get sick and you're out of the country, you need to pay attention to what you see or what medicines you get. Make sure you know what you're doing.
Yes. So in some parts of the world, you can obtain medication that hasn't necessarily had a FDA stamp of approval, such as what we see closer to home. And so it's important to know what you're taking and be sure that you've been seen by a qualified healthcare provider.
Well, that's great information. We appreciate you coming in. We appreciate you all the care that you give to your patients.
Thank you so much.
If you're getting ready to travel, check with your doctor. We'll be right back.